So good morning. Welcome to the Older Women's Health Conversation. I see many familiar faces. It's nice to see you all, and it's nice to see some new faces to our events. So for those of you who don't know about the Elder Initiative, I am Terry Clark. I'm one of the volunteers who helps to do the work that we're doing. And the Elder Initiative is a group of volunteers who are working to make our senior services inclusive and responsive and welcoming for our LGBT older adults. We have our final activity of the day is bingo, and Heshi is passing out the bingo cards. This bingo game is brought to you by Diane Menio and Carrie, and Diane will tell you a little bit about herself and a little bit about Carrie. You will be learning about the Affordable Care Act and the importance of health preventative screening. So there's some information behind this bingo game.
We're doing this not because we're in a senior center and you see they play bingo sometimes, but because I was told that I had to make this fun.
Yes.
And I wasn't sure how to do that. I saw the cooking and the Tai Chi and I thought, oh my goodness, they're gonna be like really bored. So I wanted to make it a little bit fun, but I also did it for another reason. Because what you're gonna do on that card that you have in front of you, if you have a pen or a pencil, I think Terry has some extra, she'll pass around if you need one. You're just gonna mark it if you hear me say those words. And so that means you have to listen, okay? And the one who listens the most is gonna win the bingo. And we have prizes for you. I think we're gonna use Tootsie's prizes, and I brought some tchotchkes you can take with you if you like. So, but what I want you to do, we're not gonna do this exactly the way you do bingo, because you call out, but you're gonna have the same idea. And the other reason I wanted to do this, by the way, I have to tell you this story, because when I was a kid, I played bingo with my grandmother. My mother hated bingo. And so my grandmother needed somebody to go to bingo with her. And so it was me and my sister, and we loved it. We loved those dots, and we loved the things, and we loved the prizes, and we loved being with our grandmother. And so when I think about bingo, it reminds me of my grandmother, who was very dear to me, and so that's why we're doing bingo, for a number of reasons. So when you fill up your card, like if you get a diagonal or a straight across or an up and down, say bingo, and then we'll go over your words, and then Terry will get you the prizes. And then I'm gonna keep going, because that'll give us an opportunity to kind of go over some things too. So I'm going to start now, and now is when you have to start paying attention. And I will say, well, first of all, Terry said my name. I'm Diane Menio. I'm the executive director at CARI. And for those of you who don't know, CARI stands for the Center for Advocacy for the Rights and Interests of the Elderly. I really don't have enough time to tell you all about CARI. We have brochures on the table out there, and please visit our website at cari.org. If you want to know more, but we do try to help anyone who calls us about anything, and I mean that.
Does that work count if you got it?
Does that what?
Does that work count if you have it? You said it.
Yes, it does. No, it does. See, that's why I wanted to tell you about bingo first. Every word counts. So we are the Center for Advocacy for the Rights and Interests of the Elderly. I'll say it again. So I hope you enjoyed the Tai Chi and the lunch, because those were the fun things so far. And those are about, we're here to talk about women's health. And those are important issues. Keeping yourself physically healthy, mentally healthy, and also the good diet. All of those things contribute to your health. But sometimes you have to go to the doctor. And so most of us have health insurance, and I hope everyone here has health insurance of one kind or another. I know some of you are on Medicare, and that's a good thing. If you're eligible for Medicare, it's a good thing to have that. It's a good thing to have whatever health insurance you have. But right now, we have something, we're going to talk today about probably something that's been in the news more than anything else regarding healthcare, and that's the Affordable Care Act, which is the most comprehensive health reform in the country since Medicare was enacted back in 1965. We'll talk about what it means for Medicare recipients and LGBT seniors. The Affordable Care Act was passed by Congress in 2010, and many of the provisions have been phased in. And you may know that there are some things, like for instance, if you're on Medicare and you have Medicare Part D, you might know something about the donut hole. And I'll talk a little bit more about that later, but some provisions regarding that have been already begun to phase in. Some of the important provisions that are still pending include the health insurance exchanges and Medicaid expansion. And I won't be talking as much about those today, although they will pertain to many of you here. I'll be focusing more on Medicare. The program is being administered by HHS, which stands for the Department of Health and Human Services, led by Secretary Kathleen Sebelius. So I'm going to start by asking you some questions. And I want you can just yell out whatever answers you have. Will the Affordable Care Act cut funding from Medicare? Actually, I'll ask you to put your hands up. How many believe yes, that the Affordable Care Act will cut funding from Medicare? Anyone? Okay. Few people think that. Okay. How many think it won't? How many don't know? Okay, that's fair. I will say, and this is something, and one of the reasons I'm going to ask these questions is because some of the questions I'm going to ask are areas where people are confused. This is an area that is confusing because what you will hear, and it all depends on who you're listening to, what you will hear is that Medicare is going to be cut. What's going to happen is that the Affordable Care Act is slated to save $700 billion. But it's supposed to do that without cutting any benefits. And I'll tell you a little bit about how that. So the Affordable Care Act, or Obamacare as it's known, achieves savings in the program not through cuts to the care that you're going to get, but it's payment reforms. It's service delivery innovations, the way that service is provided, and increased efforts to reduce fraud, waste, and abuse. And I can tell you that's actually something that Carrie does, is we educate seniors about fraud, waste, and abuse. And we actually got some funding through the Affordable Care Act to do that work. It's very important, and sometimes we're recovering, millions of dollars up to billions of dollars. There was a big scam, what are those called? Yeah, it was a scam, but I'm trying to think about what it's called when you target a group. But anyway, it was uncovered a few days ago in Florida and a number of other states that it's really easy to do fraud in, and it went into the billions of dollars. So sometimes, you can save money that way. And so, so the actual projected reduction in Medicare spending is largely a result of overpayments that were already being provided, and also an effort to provide coordinated payments to private Medicare plans that have been paid more than traditional Medicare. And those are called Medicare Advantage plans. Some of you may be on those plans. Essentially, the way that those plans have been paid have been, in some cases, wasteful. The insurance companies get rich, your benefits may not be any better, and so it's really looking at how the care is provided and how we can manage the dollars that are in the program better. Next question. Will the health reform law establish a government panel to make decisions about end-of-life care for people on Medicare? No. Does anybody think yes? This one has been dispelled, hopefully. Although I spoke to a group of seniors in Bucks County not that long ago, and believe me, they still think this death panel does exist. So no, it doesn't exist. Many of us heard that death panel, and you know that it actually killed a provision that allowed doctors to speak to their patients about end-of-life care. It wasn't a death panel. All it was the doctor being able to say, do you have an advance directive, to actually be able to bill for the time it takes to talk to patients. That was killed. No pun intended. And so, so what actually did end up in the bill was something called an Independent Payment Advisory Board. And so they are actually prohibited under law from restricting Medicare benefits. Oh, we have a bingo, good.
We got a bingo.
Okay.
Now, would you like a little treat from Tootsie, or would you like to see the Carrie tchotchke tray?
Okay.
My food serving day is coming back. I used to work
How
in a
about this?
Mexican restaurant.
Well, why don't you read to me read your words to me.
Okay, advocacy,
Uh-huh.
payment advisory board,
Right.
donut hole, and lunch and advantage plans.
Great, great. Oh, good. Well, those are all things we just talked about. So I won't review that too much, but I will finish talking about the Payment Advisory Board. And this is again one of those things that's become a myth, and it's some people will tell you that the Payment Advisory group is one that's going to restrict your benefits. You know, I've heard the words rationing of care come out. And there are people out there telling seniors that that's what's going to happen.
Diane, we got another bingo.
Oh, really?
And another bingo.
Okay.
Oh my gosh, like rabbits.
Okay, great.
Barbara, do you want to say where you got bingo?
Mm-hmm.
Oh, this is another bingo seniors. Elder abuse, death panels, and preventative.
I didn't say elder abuse.
Oh, I thought you did a minute ago. Oh, I'm sorry.
Oh, very good.
No, and by the way, that doesn't count.
Oh, yeah, that's.
That doesn't count that she forced me to say that.
So, did somebody else have bingo at this table? No.
Okay, so anyway, these patient advisory boards are something that, you know, that has been kind of turned into this. These are going to be groups rationing care. It's not about that. They can't restrict benefits. It's really about looking at cost sharing, looking at deductibles, co-insurance, co-payments. So it's really about the money that people have to spend to do this, and again, the funding of healthcare, not about taking away healthcare services. We have another bingo over there. Okay, Terry will be right over.
You want to say where you got bingo? Do you want them to do that, Diane? Yeah. To say what they got bingo?
Yeah, well, you go over first, and then I'll catch up.
Here I am.
And so then there is one other thing, and I just will tell you, and this is something too, again, that can be misconstrued. There is one other thing that was set up in the Affordable Care Act that could be misconstrued about, you know, how providing, you know, cutting services, and that is a group called the Patient-Centered Outcomes Research Institute. And this is where that idea of rationing of care comes in. It's really about looking at, it's conducting research with the goal of figuring out when more expensive care options work better and when they don't. So if you go to the doctor and every time you have a little ache or pain, the doctor wants you to go get an MRI, is that, and they're very expensive by the way, is that the best thing to do for certain conditions? And I'm not a medical person, so I wouldn't even decide what condition that might be good for. But is it the best thing to do in all cases? Maybe not. It might be in some cases. And so I think it doesn't rule out that you might get that most expensive care. But it also might look at whether or not the efficacy of that care is appropriate for whatever the illness you have is. Tell me what your words are.
Obamacare, overpayments, free space, Medicare, and deductible.
Free space, like that. Okay, so we've talked a lot about those things. Next question. Will the health reform law give states the option of expanding their existing Medicaid program to cover more low-income uninsured adults?
Yes.
We hope is what.
Lori got bingo.
Oh, Lori has bingo. Go ahead, tell me.
That's Lori.
It's because I just said Medicaid, is it?
Donut hole, HHS, Obamacare, low-income lunch.
Lunch, yes. Okay. Okay. We might stop that by now. We'll stop the bingo. I mean, you can do your bingos. You get your. Okay, Terry, one over here and one over there. So Terry's going to do her running, and I'm going to keep talking because we're running out of time. So in terms of the Medicaid program, the expansion of Medicaid, I think you probably all know that the law does include that. What's happened to the law since it was enacted in 2010 is that we had a Supreme Court decision on the law. And what the Supreme Court did was they upheld the Affordable Care Act. So some of us were all very happy that day because we were afraid it was going to go down the toilet and we'd never see anything happen. On the other hand, that was the good news. There was also some bad news there. And the bad news was that states could not be compelled to expand their Medicaid programs. And so over here, we got lots of bingos. And so that was the disappointing thing for many of us, is that the states did not have to do it. Now, I don't know about you, but for people.
Elder abuse yet?
No, I did not.
Okay.
And so, so anyway, so in terms of the that decision, what's happened is the decision basically said the states could not be forced to do that. And so what that has created is a system where states can decide not to expand their Medicaid program. Again, for people who are like logical, it makes sense for states to expand their Medicaid program because we have lots of uninsured people and they cost money to take care of, and wouldn't it be better to keep them healthy? Well, by the way, this is my little advocacy word to you folks, is that Pennsylvania's governor has decided we're not taking Medicaid expansion. That's a very serious problem for many of us here in the room because it's going to raise healthcare costs up overall, because we still have to take care of people who are uninsured, by the way. There's nothing you can do. When somebody goes into a hospital emergency room, they're going to get care, and they should get care. And that's why the Affordable Care Act was developed. So it is a big issue, and you should definitely let whoever you talk to, your legislators, the governor, that know that this is important. It's important to everybody. It's also, by the way, a jobs bill. It will create many more jobs in this state. It's going to improve the economy overall. I can't tell you all the reasons to do it, but it's very important. Will the health reform law increase the Medicare payroll tax on earnings for upper income Americans? No? Anybody say yes? Yes? I see yeses and nos. The answer actually is yes. It will. It increases medical hospital insurance, that Part A payroll tax on earnings for higher income taxpayers, something that at least people like me don't have to worry about. Those are people who are making more than $200,000 a year if they're an individual, or $250,000 if you're a couple. And it's going to go up from, right now we pay 1.45% out of our paychecks, if those of you who have paychecks, and it's going to go up to 2.35%. Believe me, for those 200, those people who make $1 million a year, they're not even going to notice it. And so that, and I think that one of the points here is a lot of people do like to tell us that Medicare, Social Security, Medicare are running out of money. It really, this is in part happening, this increase to help the solvency of the program.
You were saying 200-something thousand?
Yeah.
Didn't that change to 400-something thousand?
No, it's $200,000 for an individual. So once you reach $200,000 in income in the year, you would stop paying that percentage. Right now you pay Social Security tax up to, and I can't tell you the amount, it's a little over.
No, the reason why I said that was because of Congress. They were all crying about the 200,000.
Right.
Yeah.
And then they
That was
talked.
income tax.
Excuse me?
Income tax.
Yeah, that was the discussion around. That was, remember when there was all this discussion around raising the tax rates for certain individuals? That was around that. This is Medicare specifically.
Okay.
And I don't think, there are people who want to repeal the entire, still, in fact, I think it was in the,
Yesterday.
yeah, it was yesterday. So I don't know how many times they've tried to repeal this act. And part of what they do object to this, by the way, because this is called a tax. So anyway, and then the other thing that they're going to be doing is I think this is another thing that people have some misconceptions about, and that is the Part B premium payment. And so that's something that Bingo over here, Terry's over there, so you'll catch her. And so that's something that also was set by the Balanced Budget Act of '97. And so that will change over time, and there really is no way to know what's going to happen to that particular premium. Let's see. Will the health reform law cut benefits for people in the traditional Medicare program? I think I already touched a little bit on this. It won't cut those benefits. And this is where I really wanted to talk a little bit more about the donut hole. If someone, have any of you experienced dealing with the donut hole? How'd that work for you?
Well, with my insurance, it wasn't bad. I
Mhm.
had no problem with it, but I don't take the medication it caused me to go, I had double hip
Right.
replacement, so.
So you needed expensive medicine for a little while. Did you have a?
Yeah, I only wind up paying January to June, and then I get the last half of my medication is usually free.
Right, and it's gotten better over the years, because in the first year, in 2010, you got a check,
Yeah.
right? For
Yeah.
$250.
Yes.
Yeah, for those of you who are on Medicare Part D in 2010 would have gotten that. And so what's going to happen is it's going to change each year until, I think it's 2020, when by then you'll be responsible for 25%, I believe it is. Yeah. So that's one thing that truly has gotten better for people. Unfortunately, I kind of would like to not even, no, I would like just donut holes to be something you buy at Dunkin' Donuts, because still having the donut hole, it's extremely confusing, folks. I don't know how you figure it out. It's terrible. And what people end up doing when they're faced with that is they look at, what can I eliminate? What won't I take now because it's so expensive? And let's face it, drugs are expensive. And you know, one of the problems we had with Medicare Part D is that the government did nothing to hold the cost down on drugs, which we could do a lot more easily by holding the cost down on drugs rather than turning over this co-pays to you guys. So I think that's very, you know, that's a critical issue. Will quality of care be impacted under Obamacare? What do you think?
I think it might go up.
Might get better. Anybody else? I think there's a lot of people here who think it's going to get better. Well, that's what we're hoping. And the answer is yes. And part of the reason that's going to happen is because the Act really requires, it really relies on primary care doctors. Have any of you heard of the medical home, for instance? Which is something that really is, it kind of takes managed care a step further. I think we got a bingo. And it's something that takes managed care just a step further. And so so what it does is it really coordinates care through a primary care network. That's important. Now, you know, how that's it's primary care doctors, specialists, nurses, all working together to monitor care better. Sounds real good. It's been tested in some places, and where it's been tested, we have a really wonderful program in Bucks County that's been operating. They got a demonstration grant a number of years ago, and believe me, they have wonderful outcomes. And some of you may have heard of Geisinger Health Center in Pennsylvania, in the middle of the state or the northeast part of the state. They have great outcomes, and a lot of it is because of this primary care team where they really talk to one another. Because how many times, and I go to specialists, how many times does your doctor send you, do you really even know that they get the reports back? Do they discuss that with you when you go to see them? Do they talk to one another? No, they're not talking. They get pieces of paper passed back and forth, or it's on the computer getting passed back and forth, but they're really not talking. And there are incentives to do that with this. So these models really do encourage quality of care, and hopefully that will go up. The other thing that it's going to do, and I don't know why the other thing that it's going to do is provide preventive care, which is so critical for all of us to make sure, as I said, you can take care of, you can exercise, you can do all the good things for your mind, you can eat well, but in the end, things happen. And so preventative care is extremely important, including, you know, you can have an annual wellness visit, no copays on these things, by the way, and that's the big change with Obamacare, no copays. And so you can get an annual wellness visit, you can get a mammogram, other cancer screenings that you need to have, and those should be at no cost. Now, I will tell you, one thing is because it was actually our receptionist who was on Medicare, came in, and this was back in 2010 when these preventative care visits were supposed to be no copays. And she said, well, I had to pay a copay, what's wrong? And I know this has happened to me as well in my plan where because this covers everyone, not just people in Medicare. And so I went into the doctor and I thought, well, this is my annual visit, I shouldn't have to pay, and I got charged a copay. Well, if they find something wrong, they find a mole that looks funny or something like that, you're going to get charged. So there is a catch there. But make sure that you're not getting charged unfairly. Ask questions about those things, and be a good consumer. Will the health reform law provide financial help to low-income and moderate-income Americans who don't get insurance through their jobs to help them purchase coverage? Okay, and that's yes. And that's an important thing. I mean, one of the things we find is that people who we're in a crisis right now in our economy. We have high unemployment rates. Unfortunately, the highest unemployment rates are people over 50. Because if I lose my job today, it's going to be hard for me to get another job. It may not be as hard because, by the way, in the nonprofit world, we're notorious for not paying people well, but we do hire people of all ages. I'm always happy to have my 80-year-old working for me. So it's, and I'm going to be 80 still working there. So it's, but anyway, it is a crisis for people because they end up, here they are in a job for sometimes 30 years and suddenly they're unemployed. And they don't have health insurance and they can't afford those high COBRA rates that they have to pay. And so they really need a safety net. And this is going to help people to get insurance at a low cost and get subsidized if they meet the financial requirements. And there also is a program, and I didn't really want to go into much detail about the whole workplace, the plans, workplace plans. I'm still trying to understand it because I'm an employer and I've got to provide health care for my employees. So there is this reinsurance program, which is going to provide higher subsidies for employers that have employees who are over age 50 or 50. No, it's 55 to 65. If they have employees 55 to 65, there will be an extra payment because the health insurance exchanges, some of you who've had to deal with getting a health plan may know that if you want to go and get a plan, you tell them what your health is like. You have diabetes, guess what? Your rate goes up. We eliminated this pre-existing condition issue in our healthcare through this bill. The only thing that the insurance companies can rate you on now are age, geography, and smoking. So those of us who are older are going to pay more for that health insurance than the younger folks. And we're also going to pay more, depending on where we live. Philadelphia, by the way, is a high-cost healthcare market. We're going to pay more here. And then the third thing is smoking. It's hopefully going to encourage people to stop smoking. I'm not really sure how they're going to know who smokes and who doesn't smoke. But I don't know. I mean, somebody said, well, you can do a blood test, so you go to your doctor. An X-ray?
You need a chest X-ray, you can tell if the person's a smoker.
At the time? Or,
Absolutely.
but if you stop smoking, how long does it take till you don't look like a smoker?
It'll take a little
Yeah.
time, but
Okay. Well, anyway, we have yet to see how that's going to work because it hasn't been implemented. And so,
When you tell you that the insurance stuff is you're 100% right with that. My mother's 80 now. She lived in Philadelphia. She had supplemental.
her Medicare supplement.
Not her supplement. She had another kind of insurance over and above the Medicare part
Right,
that she had.
which is
okay?
a supplemental plan.
Yes, and
yeah.
she paid for that out of pocket. And she moved to Virginia about 3 or 4 years ago, and it was cut in half the cost of that same insurance between Philadelphia and Virginia.
Right.
So she only paid $150 for it, where up here she paid $350.
Yes, and that is true.
So it's a big
And,
difference.
We have the Balanced Budget Act of '96 also created categories for those, we call them sometimes Medigap plans. So it's basically picks up where your Medicare drops off. And there are categories for those that you can go from, I think, A to H or something like that. So they're different policies, and they're standard throughout the country. What isn't standard is the cost, because you're paying for what the University of Pennsylvania or Jefferson or any of these healthcare. That's the way it's based. And we also, by the way, seem to have kind of a monopoly in the market here, in the insurance market, if anyone didn't notice. So that's the other problem. One last thing that I wanted to mention to you. Does anyone know what else? Yeah, we talked a lot about healthcare, and I'm trying to look at my watch here because I know I'm supposed to let you go soon. Does anyone know what else the Affordable Care Act did besides health care? I didn't think so. There's some things that aren't very well known, and this is time to say elder abuse, by the way. The Affordable Care Act, in addition to all the health care provisions, the health insurance exchanges, expanded Medicare, Medicaid, all of those things, the closing of the donut hole, it created something called the Elder Justice Act. As advocates, we fought for that Elder Justice Act for over 10 years. And it basically languished. Nothing happened to it. We were fighting. We got a great act. We had great sponsors in the House and the Senate, and we expected it to go. Well, guess what? All of us, we woke up after the Affordable Care Act was passed in 2010, and it was put in with the Affordable Care Act. So those of us who are advocates and care about this issue of elder abuse, we're very excited to have this actually pass. It's taking a little bit of time to be implemented. We do have a panel that's met twice in Washington that's trying to look at how to do this. Funding is a challenge for it, but it is very important, and it's something that, you know, I'm not going to talk about a lot today, but another time maybe I'll be invited to talk about financial exploitation, elder abuse, which is something we work a lot with, but it is critical, and it's critical to the health and welfare of so many seniors, because if they are being exploited, if they are being abused, it's hard to stay healthy.
Diane, can I just chime in on that? And when we say abuse, I hope that they're defining it as a very wide definition of abuse. So it's
It's
financial abuse, physical abuse,
Sexual abuse, you name it,
right?
everything.
Emotional abuse, so that
Neglect.
whole piece, right?
Neglect as well.
Exactly. So really important to look at those issues and how we can really support our aging population and the people who are supporting them. So,
Exactly.
yeah, thank you.
Exactly. And I'll just mention very briefly, June 15th is World Elder Abuse Awareness Day. So hopefully you'll start seeing something in the news about that. In addition, the other thing that the Affordable Care Act does is it deals with quality of care in nursing homes. And what it does is it requires new reporting requirements for nursing homes. Also criminal background checks for employees. Until now, states have done criminal background checks, not every state, by the way, and Pennsylvania actually does criminal background checks, but we had a challenge to the law that was, basically the law was thrown out at the Pennsylvania Supreme Court, and we're still doing them through administrative action, but the law isn't behind it. And so we really, and I know a lot of people, and this gets back to that whole abuse issue, it feels that if somebody is a criminal, they shouldn't be taking care of somebody in a nursing home or in a home care situation, and that those background checks will take care of at least seeing if somebody has a criminal background check. That doesn't mean that sometimes abuse or neglect happens and the person didn't have a background. So anyway, that's the, you know, because I didn't have a lot of time, I tried to get through all those words and all that stuff, but does thank you. Did anyone have anything they want to say, anything I missed, anything you want to ask before we leave?
Can you just tell me one more time what the CARI stands for? The
Center for Advocacy for the Rights and Interests of the Elderly.
It's on the Post-it note.
Anybody wants a Post-it note?
Not the file, but
All right,
our
everybody
Post-it
gets
note.
supposed to know.
Yeah, you take a Post-it note. It's on there, and there's brochures out there. Go ahead.
Oh, okay.
Yeah, I got a question on the insurance for an elder parent. Do you think that is it a normal thing to take out an insurance policy on your mother because she's over 80?
You mean like a life insurance or a long-term care?
Well, did you say home health care?
No, I mean, what kind of insurance?
Well, she's already 80 and she has dementia. So is it a normal thing for people, like children to take out policies on their parents?
Well, she should have Medicare already, right?
But she does, but I'm talking about maybe to help towards her demise.
Well, that would be, I think what you're talking about would be called long-term care insurance.
Yeah.
If you were to take it out now, my guess is it would be prohibitively expensive. What I would, and I'm not gonna, you know, again, I don't have time to talk about long-term care insurance, and I don't want to be advising people in any case. But if you are I mean, long-term care insurance is something that the people in this room need to look into and decide whether or not it makes sense for you.
Another topic for for a conversation.
Yeah, it is a
Considering
topic.
doing something on long-term care, and I think it's very important, so keep posted, we'll be
And we
working
should
on that.
talk about, like for instance, a lot of people now look at this reverse mortgage as a way to take care. So those are things that we, as a, consumer advocate, we want to make sure people know what they're doing before they get themselves into that. Because somebody will tell you that's a good way to finance long-term care, for instance, so. Okay, well, thank you.
Let's give it up for Diane from Caring. You rock! We love your bingo. Wasn't that a great way to convey the information, right? It was so